A very warm welcome to this episode of News Audit with me, Anupati Gaur, on Oneindia English. As we know that India has been reeling under the coronavirus pandemic for almost a year now. We've seen the worst of this pandemic when India has been the second most affected country after United States in the entire world. We've seen the worst of the lockdowns, we've seen shops shut, markets shut, businesses shut, and now finally India is limping back to normalcy. In the beginning of February, we even registered lower than 10,000 per day cases, which was a big achievement. We almost thought that coronavirus pandemic was almost ending in India, but now the fears are back. There has been a surge in the coronavirus cases in 5 states of Kerala, Maharashtra, Chhattisgarh, Madhya Pradesh and Punjab. And now once again, the central government and the state government has sprung into action. Some of the lockdowns are being reimposed in some parts of the country. The national capital, Delhi, will now make it mandatory for people coming from these 5 states of Kerala, Maharashtra, Chhattisgarh, Madhya Pradesh and Punjab to carry a negative RT-PCR test if they have to enter the state. This will be effective from the 25th of February and will continue till the 15th of March. According to the Health Ministry, more than 74% of the COVID cases are in Maharashtra and Kerala. Now, Maharashtra has announced a statewide ban on the social, political and religious gatherings, besides imposing fresh local lockdowns or curbs in the districts like Pune and Amravati. Now all hopes are pinned on the vaccine. Of course, we have to continue wearing masks and practice social distancing, but vaccine is one way out. And it is a good news for all those people still waiting for the vaccines, as those above the age of 60 years and those with comorbidities who are above the age of 49 will now get a vaccine in the second phase starting from the March 1st. Those with comorbidities like diabetes, hypertension, cardiovascular diseases, stroke, cancer, chronic respiratory diseases will be prioritized above people with other diseases. The shots will be given at 10,000 government-run centers where it will be free of cost and 20,000 private centers. Charges for the vaccination at the privately run centers will be confirmed in a few days. Those who want to get vaccinated from the private hospitals will have to pay. The amount they would need to pay will be decided by the Health Ministry within 3-4 days, as they are in discussion with the manufacturers and hospitals. Around 27 crore people are expected to be covered in the second phase. Of this group, around 10 crore people are over 60. Last month, sources said that Prime Minister Narendra Modi would be vaccinated in the second phase, as well as all the chief ministers, MPs, MLAs above 50 years. So as the vaccination drive expands to include the larger population, there will be segregation based on several criteria, and that each subgroup will have separate timelines. If we talk about the first phase, which began on January 16th, the centre targeted vaccination of around 3 core healthcare staff and frontline workers. However, as of this morning, only 1.21 crore people have been vaccinated. Of these, around 14 lakh have received the mandatory second shot. Now, India has so far approved of 2 vaccines for emergency usage: Covid-Shield, which was developed by AstraZeneca and Oxford University and manufactured by the Serum Institute, and Bharat Biotech's Covaxin. So the coronavirus pandemic is yet not over in India. Now we are witnessing another spike. This could be a second surge. We have seen that 5 states are witnessing a surge in COVID-19 cases. So this is a time to pay utmost attention, to practice social distancing, to wear a mask when we go out. Stay safe, stay protected and fight COVID-19. That's all in this part of News Audit.